back plug, which ends up going to the Medtronic Symplicity generator. The generator itself has a few separate components to it. One that include the insertion port for the catheter itself. There is a ground pad that also has to be put on the actual ground, and it's its own separate plug. Important, because without this you won't really be able to generate the current you need to actually create the full denervation effect. And we have here, you can't see too well because of the lights, but these 4 lights here, now you can see them a little bit better. Right, these 4 lights are basically going to be the 4 buttons are the ones that are going to be able to use to actually control each of the individual electrodes that are going to be on the spiral catheter. There's a mode to select whether you're working on the right or the left kidney, so the machine also knows, and then simply about how to deliver the actual pulse itself.
Let's go with the run.
This is going to be important because this is going to be how you will be able to select which of the actual electrodes will be doing the actual the delivery of the actual electricity or the radio frequency to do the actual denervation portion, because there are going to be times where you may be having overlapping of the actual electrodes based off the length of the segment of the renal artery that you're going to be treating, that you would actually not want to double treat in a particular area, or if you're at the level of a carina or a bifurcation, you want to limit the amount of energy being delivered over there. The machine itself is again does the bulk of the work. Assuming you have good contact, and again, we'll be able to talk a whole lot more about that, you should be able to deliver the total of the 60 seconds of the therapy. Sometimes what may happen is that you may have issues where you have inappropriate vessel contact, too much impedance, and so on and so forth. And when this happens, the machine will make it very, very clear to you, and it'll turn that catheter off. It'll turn it'll turn either just that specific electrode off, and I'm sure we're going to run into that here. And it will say that this particular electrode was not able to deliver the full.
I think that's where the efficacy of the whole catheter comes in. You can use on both sides of the vessels and then treat it appropriately in all the branches as much as possible. I guess the important criteria you talked about is 3 to 8 millimeters, which you have to always consider.
Entering the catheter into the body now. So just to let you know that it's a standard load of a stiff wire. We changed the wire to a stiffer wire, which is the Grand Slam. And now we're in a 7 French PK1 guide, which is a Medtronic guide as well. And we're going to enter in, and let's see, high impedance. Okay, that's fine. And now we're entering in, and I'm just going to have them just give a little slight puff for me, because I just want to make sure which branch we're going into here. That's fine. I'm just going to go up to there, if that's okay with you guys. And then I'm just going to pull the wire out here. Big picture, that's it. So we're across the branch,
beautiful.
but I think we're perfect. We can just turn off the last probe, and I think the rest of it. So guys, can we talk a little bit about the monitor, Roman? Because it's important for everybody to understand that we don't want to ablate across a branch point.
Yeah, so the first one is really at that distal point, and I think that one, for as Piggy was saying, it's at a bifurcation point, but it's also where the vessel is becoming pretty small. So really, it's pretty intuitive, kind of just push number 1. And remember, it's important, 1, 2, 3, 4 is not from the proximal to distal, but distal to proximal. So number 1 is the probe that is the electrode that is most distal in your actual spiral catheter. So number 1 we'll turn on, 2 we'll keep on, 3 we keep on, 4 I think is also okay. Yeah, so
12 should be fine too.
Yeah. So now, really simple.
What about number? I think we keep all 4 on there, guys.
No, 1 is off.
Yeah, 1 is
but
off.
we would like to keep all 4. I think we'll keep all 4 of them on. I think we can.
Okay.
So 1 is right now is off on the monitor. That's why we see Roman.
1 was actually, we need to be careful that it's not on the carina. So that is probably the reason why they decided to deselect it. Yeah.
Number 1 is off intentionally.
Yes.
2, 3, and 4 we are keeping on.
Yeah.
So again, the last part of the device, it's just hit the RF button and that's it. Now, as the spiral catheter is doing the denervation portion, the machine itself is doing a lot of the work. Giving the sedation to the patient beforehand is super important. So
we're just going to treat in 4. So what I'm going to do is just rotate it slightly like
Correct.
that.
Yeah.
I'm going to clock it, and then we're going to look at the impedance, and you can see it's a 188. Guys, are you okay with that? Everything good with that number?
It looks very stable.
Yeah.
Okay, so we're looking for stability, and Elizabeth is given medicine, and now we're going to ablate again. As Dr. Sharma said, what we're doing is we're rotating, and now I'm holding it. And obviously, the pain starts around 45 seconds. Advance the wire, and then we're going to pull the catheter back and get the stock.
Right.
So I'm just going to advance the wire.
Yeah. So we're trying to avoid ostium. That's one thing that you don't want to induce morphological changes and start atherosclerosis or accelerate it a little bit.
Okay.
5 millimeters, 1 electrode length.
Yeah.
Okay, can you just go over them? What numbers look good, bad, ugly?
Yeah. So we are not actually specifically after a certain number or achievement, but what you see here really is a nice increase of temperature. So we have these in the blue, we have in percentage the drop of impedance, which for us is actually only an indicator that we heated up the tissue. It's not that we are specifically after a certain drop of impedance, but for us it's just like feedback that we really heated up the tissue. So a nice confirmation.
So that's your blue graph showing where the temperature has been consistent enough. That means there's enough contact and deliverability.
On the blue graph, the temperature increasing, on the white line, the impedance dropping. Perfect. So that's what you see on the
So that's the ideal condition.
Yes. One way to think about this is that you have two types of tissues in that environment, blood and vessel wall.
Right.
And they have different resistance, electrical resistance. So blood has very little, the vessel wall has high. Anytime the resistance goes low, that means the impedance is low. That means you're not attaching to the vessel wall. You have no contact. So, but every person has different numbers.
Right. Thought about using, let's say, IVUS sizing, like how we were discussing, whether it's borderline, whether it's 2.5, whether it's 3.1. Have you ever thought or seen anybody do an IVUS of the artery to really define the anatomy, or is it just purely angiographical?
So in all our clinical trials, we have just gone by angiographical assessment.
Right.
And then also the electrodes itself, they have a diameter of 1 millimeter. So if in doubt, you can still use the electrode
as the
reference.
Yeah. That's
so
amazing.
This, like we said, and hold on, let me get out there.
Yeah.
Maybe up to there. I like that. And we're gonna ablate that prior to that first bifurcation, the distal area. Then we're gonna pull back, put the wire into that larger downgoing branch, and then we're gonna ablate that area. Then we're gonna pull back and ablate the ostium, or near the ostium, as Stefan said.
Right.
And then when we're done, good right there. This is
because we already covered that segment.
It will come back when
it comes back.
Is really interesting. So this
Foreshortening.
this proximal portion of the renal artery is larger in caliber than the other one.
Absolutely.
Yes.
And we see what is the capacity of this device to accommodate to the actual vessel size. So this is clearly a much bigger vessel. And we see how much this catheter wants to foreshorten to take its original.
So I think we're gonna leave 4 off and do 1.
Correct.
2, 3.
Correct. Yeah, that's how we were talking. Is like
we agree.
Ready? Are they ready?
I think.